the cloud, and then there's always a lag on I never know when exactly we go live. So
Okay.
that's where I get a little bit, it's a bit funny. One time it was 30 seconds where we were all just sitting there quietly. So now I just chat through this whole process.
Okay. Fair enough.
Technology, right? It's just, sometimes it doesn't say 3, 2, 1, go.
Yes.
And then I'm stuck there. Am I live? Am I not live? And then I'm looking at my phone, and I didn't like that yesterday, but doesn't matter.
I did a video counseling session with a client earlier this morning, and it worked beautifully last time. And this time she couldn't get on for some reason.
Well, I tell you, it's the bane of our existence. Sometimes it's just like, oh, why are you doing this to me? Why does it work sometimes and it doesn't? But it's all good. And I'm so excited to be chatting with you today, Rosa. Let's see here, go live. Here, we're going live. Such an important topic we're talking about.
Thank you for having me.
We might have to say that again, but here I don't see myself. Here we go.
The dress rehearsal.
Yeah. Go live. Anyway, yeah, it's like a dress rehearsal. And the thing is, live, you don't, we're live. We don't get to edit what we're saying. So we're just on here. Waiting. Here, I see that we're live now, so we're just going to go live. Okay. Hello, everyone. Sylvia here from Rock the Cradle, where our team of doulas, birth and postpartum doulas, want you to have the most positive birth and parenting experience possible. And that's why we do these Doula Dialogues, where we invite special guests to come and talk to us about all different types of aspects of your journeys. And today, I'm so excited. I've known Rosa for a while, but we have Rosa Caporicci, who works out of NDG Therapy. It's her company. She's a psychotherapist. And we've been in a relationship, Rosa, for many years. I think for quite a few years now, where clients that need her services go and see her. Rosa, you're going to touch upon, but welcome.
Thank you.
Welcome. Maybe tell us a little bit. Today, the topic that we're talking about are perinatal mood and anxiety disorders, which includes postpartum depression. And Rosa's going to tell us more what this is about. How do we see the signs of this? What factors are it's increasing? Rosa and I were talking yesterday, and 1 in 7 women and 1 in 10 men are being diagnosed with these disorders. So we're going to kind of delve into that. What social factors are contributing to this increase? How do we see these signs? What can we do? That's what we're talking about today as well. What can we do if I'm experiencing, or if you're experiencing this, or someone that you know, a BFF or your friend or a colleague? What can we do? And Rosa will talk about some resources as well and the services she provides. So Rosa, that was our introduction. Tell us a little bit more about you and you work with so many different aspects of that reproductive journey. What is, tell us more.
So first of all, I want to thank you for having me. And I think
my pleasure.
A wonderful initiative. So yes, it's when you say company, it's much more impressive than it actually is. It's just me in my little practice. I'm a one person operation, but yes, I do work in NDG, where I also live. And I'm a licensed psychotherapist, and I chose to specialize my practice in reproductive mental health. And I was inspired to do so, not surprisingly, because of my own firsthand experience. So I am a mother of 3 living children. I've had 4 pregnancies, and between the after the second, we experienced pregnancy interruption. We had a diagnosis of a chromosomal abnormality, and tragically, we chose to interrupt the pregnancy at 18 weeks. So that's an area I work in. Also, perinatal loss, whether due to miscarriage, stillbirth, pregnancy interruption, and also infertility. So that's something I'm very passionate about, as I am about the perinatal journey. So perinatal mood and anxiety disorders, because similarly, I experienced perinatal mood and anxiety disorder quite likely after my second, but without definitely after my, quite likely with my first, but definitely after my second. And though medication was tremendously helpful, I'm glad we're talking about this, because I find the biomedical emphasis, while absolutely crucial, is sometimes inadequate. We need to talk about the other impacts or influences in how we think about childbirth and the postpartum period, which and I'm not a researcher, so I'm only offering anecdotal clinical evidence, but nonetheless, it is.
Well, it's what you're seeing. It's what you're seeing. Your clients are coming to you, they're coming to me, and they're saying, this is what's happening, right? So I think it's very valid. We're actually hearing what the people are saying.
Yes.
Which is so important.
And what I remember vividly is feeling so ashamed about myself. And I think that is part and parcel of the problem. The way we frame pregnancy and having a baby is only seen from the vantage point of bliss.
Right. Yes.
And we don't talk about it in realistic terms, and that's my number one complaint. And I'm not, and I think we do that. It's misguided, because we think we don't want to scare parents, but there can be a middle ground.
I know, I find myself, Rosa, and sometimes in our prenatal classes, and I'm getting into a topic, something like this, that's super important, but then I see the faces of the people in front of me, and I'm like, oh, I have to tone this back down a little bit, because I don't want to scare them too much, but I do want to give them some little bit of, how it can be. Not for everybody necessarily, but you do, it's true. We don't want to scare them, but I think framing it a little bit more realistically, and not like we had that chat yesterday, and part of our talk today about how social media is a big factor in our expectations of how motherhood should be, right?
Yes. Parenthood is not an Instagram post.
Right.
So,
but it is thousands of Instagram posts on motherhood and parenthood. Can you break down perinatal mood and anxiety disorder? We've named them this way, but what does that look like? What is that? Sure. Perinatal for people who might not know, is before, during, and after birth, right? The whole journey.
Yes, it sort of captures, because historically it's been named postpartum depression, but that is extremely limiting. Yes, so there is these symptoms can appear during the pregnancy, prior to the arrival of the baby. And the first thing I want to say, as you pointed out, it is much more common than we think. It is actually the number one medical complication related to childbearing.
Wow. Anxiety before birth.
Anxiety, depression, along that spectrum. Right. It's more prevalent than even gestational diabetes, hypertension during pregnancy, and ironically, though, we don't screen for it.
No, we don't. And I have so many in our practice. I have seen over the years that I've been doing this, many more, particularly women, many more of them coming to us with already these symptoms and a high level of anxiety. And I think the pregnancy just, even, if you already have anxiety and depression, it makes it 3 times as worse. Oh my gosh.
Yes. So that may be in part due to a lack of training to identify this as an issue. And also I think on the part of medical practitioners, they don't know what to do with it, where to refer. So there is a lack of resource. So 1 in 7, as you pointed, and again 1 in 10 men. So and certainly if the person has a history of mental health challenges, it puts them at risk. Does that mean it's inevitable? No, but it should be, particular attention should be paid to how they are feeling about psychologically and emotionally feeling about the pregnancy. So certainly, so if there's a presentation either before or after the person who is, and beyond 2 weeks. So when we're talking about postpartum, the red flags are raised if the symptoms persist beyond 2 weeks. And those are symptoms such as high emotionality, crying, but it can also be exhibited as irritability and anger, restlessness, hopelessness, feelings of inadequacy, which again, in this context is fairly normal.
I would say so, Rosa. I'm thinking of this and thinking of when I had my baby.
Yes.
Every single time, I think for the first 2 weeks, if not even more.
Yes.
And I was never clinically diagnosed. For me, it was more exhaustion in my first that lasted months and months and months. And I didn't get care for that. But it, it's a fine line to determine, am I, having this anxiety disorder? Because I was very irritable. Every child I had, I was very irritable. I wasn't sleeping, feeding, you've got all these issues. You're sore, you're bleeding. So I think we tell clients in our practice, and you'll correct me if I'm wrong, it's, if it's not getting better over time, if it is getting worse and you are not feeling, we can't always be in love with our baby, of course not.
No.
But if it's not getting better, if we're not having moments of feeling somewhat normal.
Yes. So that's so within beyond that 2 week period is when we should pay particular attention. And certainly, if there is any sense of suicidality, that is, you do not wait. You do not wait. But that period, and that's another thing that should be clarified. Baby blues, as we know them, is not a precursor of a postpartum mood and anxiety disorder.
No, I think 80% of moms get that, right? I mean, if not everybody, a little bit of baby blues.
Right, and we don't quite know all the reasons. Some of the reasons may be attributed to a hormonal fluctuation. So there, you can be weepy and a little bewildered during that immediate period. But beyond 2 weeks, if that persists, or as you say, if the symptoms worsen, that should be attended to. The problem is, again, because we talk about pregnancy as the best time in your life, and you're going to fall in love with your baby, you'll be over the moon, and that doesn't happen, women feel ashamed and they don't say anything. Because they don't feel it's
guilty.
Not,
I'm not normal.
Right,
I'm not. Why am I not in love with my baby? Right? And
yes.
Well,
and that's the thing. I talk about this a lot in my practice. Is the very dangerous conflation we make with loving your child and sometimes hating the job. And I really do look at motherhood as a job.
Oh, yes. And I was telling you that I find it was the hardest job. When I went back to work after each baby, I was like, oh my God, I can have a break now. It was so much easier to go to work than it was to be at home. And our clientele are lots of career women. And we are not training them. They're on the go. They are powerhouses. And we're saying, you should take that 1 year off because you have it. And some of my friends were like, I'm taking 3 months off. I'm going back to work because I love it and it's much easier. And that's what I thrive doing. But feel they get lots of pushback from that, right? It's an amazing point. It's a really, really good point. And we talk about it a lot.
Right.
Going from a career to staying at home and doing laundry and cleaning and groceries. And you pick up almost 100% of the chores at home.
Unfortunately, yes, that persists. So I'm actually very careful never to refer to motherhood as an identity. I find that nomenclature problematic because if you're not feeling like the good mother, if you are not, embracing that identity, you feel abnormal. But if we talked about it as a job, people would be much more comfortable saying, yeah, I don't know of any job where I never get a break, where it's
up all night.
You're up all night, and you are not you are not allowed to complain.
Yeah,
that just wouldn't happen. But yet we see pregnancy and childbirth as natural. So why should there be any displeasure in it? And it's philosophically very confounding the way we persist in talking about this.
Yes, and it is these social factors of the society we're living in. I do not think our mothers, Rosa, you and my mothers, had this so much pressure on their shoulders. There's a meme going around, it comes back every once in a while, where you have 1970s mom. Their role was to keep your child alive, you know, fed and alive. And they would send you out the door, come back at night before it's dark, right?
Yes.
The 2020 mom, you know, the 2000s mom, there is a list of everything. And I look at that list and I'm going, oh my God, sometimes I get caught up in all of that as well. And I have to bring it, you know, okay, if my third child is not taking classes on something, that I'm okay with that. I have to remind myself, you know.
Well, exactly. And as I joked with you yesterday, though if any of my clients are listening, they'll say, "Oh, yeah, that sounds familiar." I say, despite the fact I didn't have my children 100 years ago, my eldest is 23, but the emphasis on good practice as a mother the intensity is. It's surprising to me sometimes that the rates aren't even higher.
Well, I think so too. And I quote 1 out of 4. And when you were saying it's 1 out of 7, and I trust your stats more than mine. But, and maybe they're not all clinical. I mean, I never got clinically diagnosed, but I know I had something. After years of looking back on it and having other children, I'm like, oh, that's probably what it was. You know, how come I didn't go and ask for help? But it was like, this must be normal, just to be in this fog. I was looking at a photo of my little babies, and they were maybe 1, 3, and 5 at the time. And there was an expression on my face of this woman just looking far off, being there, but not being there. And I don't remember a lot of it. I don't remember a lot of it. It's unfortunate, but I think I don't want to normalize that either. But,
no, but you're pointing out, I think another contributing factor is, especially when I hear of clients who do not have a network of support, i.e. family, on the ground.
How hard.
That's a risk factor. And again, I'm very careful to point out, is that a cause, and will it be inevitable that the person will be afflicted with a disorder? No. But it's something that needs to be attended to. So yes. So similarly, in our previous generations, there were neighborhoods, there were real communities, and we still need that.
We still do. Humans are we need that connection, and we're urging our clients to get out. Montreal winters, you know, I think very different than if you live down south, or, you know, in a country or a state that's, you know, nice all the time. Well, you get out much more. Here in our winters, you know, it's hard to get out sometimes. I get that. -20, who wants to go out?
Right.
But so important.
The other thing I also would like to mention is this notion, and I think as a feminist, and not to be too conspiratorial, I think it suits the patriarchy that this is still, you know, in circulation. We are not superior parents by virtue of our biology. Let's stop putting the emphasis on motherhood. Let's talk about the family. Let's talk about parenting. And why do we, you know, what women get frustrated with their partners, and I'm mentioning men, it doesn't necessarily be men, but we get frustrated with them because they don't know what to do. But the thing is, we get so much more practice. That's why we're more skilled at it. And you know, if I could rule the world, I wouldn't have a 1-year maternity leave. It would be time shared with both parents, where there are 2 parents at the same time, because this is not the job of one person alone.
Right. Yeah, there's so many. I'm thinking, oh my gosh, the finances, and how do we work this out? In other countries now, you see more and more. I just posted something on the page last week where Finland is upping the parental leave. So it is happening. The Nordic countries, let's make a mention, talking about feminism, they are all run by women. And they are putting these family practices in place where time off is shared by both, perhaps not at the same time, but women are not getting the whole year. I mean, I enjoyed my year, but I would have definitely loved, more help. And I think my spouse, more and more young men are spouses are wanting to stay home. And I see a lot more shared maternity leaves now than before.
And the research shows that children benefit from time with different parenting styles. There's a doctor, researcher out of Yale that has done studies with respect to the role of fathers. So we give them short shrift, and that just perpetuates this merry-go-round where we feel we're supposed to do it all, we're supposed to be brilliant at it, and then we're shocked that our world's upended, and that there is loss. And this is something I was talking about with a client just yesterday, that she was befuddled that she is not thrilled with motherhood and feeling again ashamed. I miss my life. Of course you miss your life. This is one of the most dramatic transitions.
Everything changes. Your body changes. Everything, and the lack of sleep, I thought, really
is a major factor.
Changed. Yes, it's such a major factor for sure. So having that support. I remember talking about spouses, you're right, being behind, looking at what they're doing. Oh, you're not doing that, do it this way, do it my way, right?
Mm-hmm.
And then what happens is then they stop doing it altogether because they're being criticized. So it's a vicious circle that sometimes we create. I love that you say, Rosa, I mean, that when we talk about some women have shared with me that, they were waiting for the black cloud and perhaps the suicidal thoughts or perhaps harming their baby kind of thoughts to come about before. That's what they thought postpartum depression was. And rather it can take different shapes and, and forms of, I'm unhappy, right? This is where we're coming. I'm not thriving in this motherhood. So I think I say that again, I want to repeat it so that whoever's listening here live in the chat or in the replay, that postpartum depression takes on many, many forms.
Yes.
And to not wait. Your caregivers, and something that we didn't mention is that you were saying 2 weeks. Look at, how are the symptoms going after 2 weeks? We don't often get to see our doctors. It's a 6-week appointment, and sometimes it's a 2 to 3 month appointment that, they push it back all the time. So these new moms, in the most vulnerable time, you're not getting the support.
Right. So there are some clinicians out there like myself who can offer a link, and I encourage people. I offer a 50-minute free telephone consultation just to help the person situate themselves and discern whether there is something more concerning or not. And there are organizations out there, like one I'm affiliated with, and I wanted to mention Postpartum Support International. They have a very robust offerings, incling valid and reliable information, which is also my hobby.
Evidence-based, right?
Don't just go,
to Google. Do not go on the Google mommy forums. No.
They offer a toll-free telephone support line. They offer online monitored support groups for fathers and mothers. And there's one out west as well, Postpartum Support Society. So these are good places to gather information and to validate whether there's something worrisome or not. So it is terrifying, and I say that because I remember experiencing it, to feel this way. But as the motto that I like to use from Postpartum Support International is that this is not your fault. You're not choosing to feel this way.
Right.
You're not alone, because it's much more prevalent than we say, and it is highly treatable. Now, does that always mean medication? No, but it's treatable.
Yes.
So it's not it doesn't need to last forever. The risk is when it is ignored and women just plow through it, and then there's the danger of it becoming chronic. But don't feel ashamed that you're not over the moon. It's okay. You can say that. another thing I often say with my clients is that it is, and we can hold two opposing and conflicting feelings and thoughts in our mind and in our psyches. That's normal. It's not black or white.
Oh yeah, I would flip-flop all the time, right?
Mm-hmm.
Flip-flop from being very, very happy to not being happy. Just
Yes.
that was a lot.
Yes.
I love these. Thank you so much, Rosie. These are great points that we've touched the surface, and you know we can't go in. This is not a day-long conference.
Right.
Rosa is a part of the Montreal Mental Health, I would say, associations here, and she does do these deep dive, you know, longer talks and conferences.
Right.
She's going to put her link to her website, her web page in the comments. Please reach out. Even if there's a doubt in your mind that you might think there's something, better to call her and find out if there is something there. And sometimes just chatting with someone who has experienced this and who has lots of clients, many clients reach out to her, and she's working with them. We want to experience, you know, I think a happy maternity leave. And like she said, there are solutions to that.
Yes.
We're still winter time. Do get out there, do connect with others. Sometimes just finding one other woman or parent who's at home with their babies to go for a walk or take a coffee together can really, really help.
Yeah.
Any last thoughts, Rosa?
Just that I couldn't agree more. There is healing in fellowship. So just being able to, it's very cathartic, but being able to tell your truth can be very healing.
I love that.
And you are entitled to it. That's your experience. And it doesn't have to be a certain way.
No guilt, no shame. It is what it is. And there are resources out there.
Yeah.
Thank you so much.
So,
it was a great talk. That half hour just went zooming by.
I appreciate it.
Thank you everyone for listening. Like I said, reach out to Rosa, reach out to our group. We have postpartum doulas who go into your homes and help you with certain issues that you may be having, allowing you to rest and sleep, and providing meals for you and tidying up to make you feel a little bit better in your day and that you've got this. There are lots of resources out there. Join us next time. In the meantime, if you are not, we have a Facebook group called This Motherhood Journey. You're very welcome to join, and I will catch you next time. Thank you so much again. Have a great weekend, everybody.
Pleasure.
Bye.
Thank you.
Bye, Rosa.
Bye-bye.